Hi, good morning, Watson. My name is Julie Markson. I'm your invigilator for the OET speaking session on the 7th of April 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Watson McKinney.
And what is your candidate number, please?
My candidate number is 2232987.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How much does a vaccine reduce the risk of COVID-19 and its complications?
According to FDA guidance, set as an expectation for licensure, that a COVID-19 vaccine would prevent disease, or decrease its severity, in at least 50% of people who are vaccinated. While the study showed a 50% reduction in illness, the confidence interval for the efficacy estimate might be 30% to 80%, meaning efficacy may be as low as 30% or as high as 80%. It will also be important to understand whether a vaccine reduces not only mild, but also more severe disease, as well as hospitalizations and deaths. However, studies may have insufficient numbers of patients with severe outcomes to definitively evaluate those endpoints.
How safe is a vaccine candidate?
Clinicians will want to know how safety was evaluated, including whether studies have been completed as planned. It is likely that vaccination will be associated with mild adverse events, like soreness at the injection site, fever, fatigue, and myalgias. While such symptoms may be unpleasant, so long as they are not severe and resolve quickly, and patients anticipate them, these symptoms are not usually worrisome, unless they lead to additional healthcare encounters.
Will the vaccine be effective for all patients?
COVID-19 is more common and severe among individuals, often underrepresented in clinical trials, including older individuals, people with chronic illnesses, and persons in racial or ethnic minority populations. Different groups may not have the same responses to vaccination. When results become available, it will be important to evaluate the characteristics of people included in the trial, and determine whether they are similar to patients seen in the practice setting. A given vaccine may be more appropriate for some patients than others, and knowing those differences will be important.
Will all COVID-19 vaccines be the same?
Different vaccines are likely to perform and be used differently. Clinicians will need to be aware of any differences between vaccines, including dose numbers and schedules, as well as safety and efficacy. Importantly, some vaccines may be preferred for certain populations. Clinicians should understand the basics of how different vaccines perform, and, if more than one is available, be able to recommend the best for a given patient.
Can vaccinated people stop worrying about COVID-19?
While a vaccine will help protect individual patients and those around them, a large proportion of the population must be immunized and protected before transmission is substantially reduced. Especially for 2-dose regimens, this will take months. No vaccine will be 100% effective, and a vaccine that protects against developing clinical illness may not prevent transmission to others. Also, the duration of naturally occurring immunity to infection, with severe acute respiratory syndrome, coronavirus 2, is unknown and may wane with time. Therefore, the likely duration of protection by new COVID-19 vaccines is unknown.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning, Julie. My name is Watson McKinney. I will be your attending nurse here today. How are you?
Good morning, nurse. I'm good. Thank you for asking.
We will be discussing your test result, which you have received today.
Okay, nurse.
Before going to the test result, can you explain to me about the symptoms you experienced, please?
I had some episodes of painful abdominal cramps. Beyond that, I experienced frequent wind problems, which are very embarrassing. Bowel problems were also noted, that's why I decided to do the test.
Sorry to hear that, you have experienced these difficulties. Can you give me an idea about the onset of your condition, please?
Actually, it started about 3 months ago. I had bouts of diarrhea and constipation, which has occurred a few more times. As a result, I have been off my food several times.
Can you recall any trigger factors for your condition?
I couldn't specifically recall anything like that.
During the time you experienced these symptoms, were you under any stress, or undergone any lifestyle changes?
Yes, nurse, there was such an incident. I had a lot of stress at that time, as I have started a new job, which is highly paid, but very stressful. Moreover, I have noticed that it was worse a few months ago. I felt bloated and was very uncomfortable. Also, it is very painful when it happens.
All right. Julie, You are diagnosed with Irritable Bowel Syndrome, IBS. Do you have any idea about IBS?
Well, nurse, I have heard the name before, IBS, but I don't know anything about it.
It's okay, Julie. I will explain what IBS is.
Okay.
In the simple language, IBS has no clear cause for the occurrence. However, the intestines are probably very sensitive at times, so that the smooth muscle becomes overactive, resulting in spasms, cramps, etc. Due to IBS, either constipation, diarrhea, or both can be experienced.
I thought it meant that I will be allergic to fiber in food, or something like that.
Oh, I see. IBS is an intestinal disorder, with no clear cause for its occurrence, but results in stomach pain, wind, diarrhea, and constipation.
So nurse, what can be done to cover my condition?
Your concerns are reasonable, Julie. I will outline some treatment options for you.
You may please.
Julie, you have to take the prescribed medications that have been supplied, which includes medication for pain, diarrhea, and constipation. These are the medications for your symptoms.
Okay, nurse, I will take them as prescribed.
Nevertheless, you need to make diet changes and some stress management techniques to overcome your condition.
All right, nurse.
You can control your symptoms by managing diet, lifestyle, and stress, along with medication and counseling for stress.
I will take care of it, nurse.
Diet change mainly includes avoiding high-fiber foods and gas-producing foods like cabbage, eating regular meals, etc.
Oh, okay.
For stress management, I can suggest activities like yoga, meditation, or gentle walks.
Nurse, I understand about tablets. But my concern is that I should only take the tablets if I have cramps, diarrhea, or vomiting. Isn't it?
Yes, Julie. Only when you suffer these symptoms, you should consume them as prescribed. They are not meant for regular intake.
All right, I understand that.
Do you have any other queries that I have to address?
Yes, nurse. If I am not wrong, the other suggestions, diet changes and stress management, are things that I should do all the time to prevent future bouts of the condition.
Your understanding is very true, Julie. IBS is mainly controlled by stress management and diet modifications. When you correct them, you can see your symptoms are well managed, and no such difficulties will be experienced.
Okay, nurse. Now I understand the things.
Good to hear that, Julie. If you have any more queries, feel free to contact us. I wish you a speedy recovery.
Thank you, nurse. That is the end of your out-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.